Welcome to Health Records Management. We are going to start on your first PowerPoint. This PowerPoint is going to cover the beginning of Chapter 4 in your textbook. So let's just start off here, introduction to a patient record. So we're talking patient record, medical record, health record, so many different names, and they all mean the same. So everybody here listening has a patient record unless you've never been to a hospital or to a doctor's office, then you do not. The paper and electronic record have many purposes but only one goal. They want to document patient care. All records contain patient identification information, which this can be inpatient, outpatient, alternative care facilities do serve as documentation source for patient care. So the patient record itself, it serves as a business record for a patient encounter. It's documentation of all healthcare services provided to the patient. So what does it include? Demographic data, as well as documentation to support the diagnosis, justify treatment, and record treatment results. So let's cover demographic data. It's the patient identification information. It's collected according to the facility policy and includes the patient's name and other information. So let's think of some examples. Okay, so demographic information is going to be the date of birth, the place of birth, possibly the mother's maiden name, social security number. Pages of the record need to include the name of the provider, the patient's name, the medical record number, the date of admission and visit, and the name and address number of the facility. It's the same on the electronic health record too. So information capture. This is the process of recording representations of human thought, perceptions, or actions and documenting patient care. This means for information, capture handwriting, if you're speaking, if you're typing, or touching a screen, or if you videotape and auto recordings. Keep in mind a report generation is a construction of a healthcare document, whether it's paper or digital, and it consists of formatting and structuring or capturing that information. Let's go to the big one here, confidentiality of a patient record. One of the most important responsibilities of the health information practitioner is to safeguard the confidentiality of a patient record. Healthcare providers are bound by various state laws and ethical standards to maintain the confidentiality of private health information. So again, when we're talking about this is if you are working as a medical assistant, health information technologist, or any allied health profession, you want to make sure the information you read in a medical record stays in the medical record. You don't want to talk about anybody's medical record in the elevator, to your friends, or even to your colleagues. This is something, again, you need confidentiality. I have seen one too many times people getting fired over breaching confidentiality in the medical record. A great example just happened last year with the Jussie Smollett situation. They had close to 100 people get fired because they breached information on his record. So what is non-confidential information? This is common knowledge. There's not a specific request by the patient to restrict disclosure, so name of the patient's okay, verification of the hospitalization or outpatient services, and the date of service. This is all non-confidential. Legal requirements of the health record. State laws and regulations specify that healthcare institutions, they must keep medical records. Keep in mind though, there's no federal laws. But there are federal laws and regulations which apply if the institution wants to get reimbursed for the treatment of Medicare and Medicaid patients. So of course, everybody is going to keep a medical record. If you want to get paid for the services of that patient, you're going to keep a medical record. Medical transcription. This is medical information is dictated by a provider into a system that stores dictation. Medical transcriptionist listens to the dictated information and then keyboards the report. Right now, it's voice recognition software is pretty much taken over. So everybody knows what this is. You talk into your iPhone, and again, when you want to record a message or anything like that, it's talk to text. The big thing that you will see in a lot of facilities is called Dragon. So a lot of transcriptionists are, at this point, their jobs aren't as fluid as they were as one time. So they are starting to go away. There is a lot of bumps and things that need to be worked out with voice recognition software. Just look at the different types of things that come up on your phone when you try to talk into it. So they need to master that a little bit more. Medical transcription, there is an Association for Healthcare Documentation Integrity. The provider reviews the report for accuracy. And then let's talk about it. What different reports are generated as a result of medical transcription? Okay, so this could be the history and physical, progress notes, consultations, the discharge summary, radiology reports. So also keep in mind it involves keyboarding medical information dictated by a provider into a dictation system. It stores it on tape, and then again it waits until the transcription and pulls it off. Okay, so let's talk about the primary purpose of patient record. It is the continuity of care, documentation of a patient care services so that others who treat that patient have a source of treatment they can base additional care and treatment. It is a big communication tool. So this way, if you are going in and let's say you're having trouble breathing, sinus infection, so you just have a whole respiratory sickness going on. So you go to, let's say, to an acute care facility. So at that point, they document what's going on. You go back a week later, you're still not getting any better. The doctor at that point reads your documentation from the first time. They see what that physician treated you with, what your symptoms were. Have they gotten worse? At this point, again, it helps for you for continuity of care. Who owns the medical record? Okay, this can be a little tricky. So the medical record itself is the property of the provider. It's governed by federal and state laws. The patient has right to access its contents for review. Now, the physical record is the facility's, and the information in it is the patient's. So again, the information is yours, the patient, but the physical record itself is the facility. Inaccurate information can be amended. Patient can write a letter clarifying the information, which is then filed in the record. They're not going to take that information out. So let's say you go to the doctor, you're upset, you're acting a little bit off the wall, and the doctor writes that in there. Patient is acting very crazy today, not complying, goes on and on. You read that and you're like, you know what? That's not what happened. So you can go in there and ask to amend it. They're not going to take the original out, but they will put an addendum to it. Okay, let's talk electronic health records. This is pretty much what you see anymore. In this class, you will deal with lots of electronic records. We'll get you lots of practice in, going around navigating through one. It is also called electronic medical records, computer-based patient records. Each facility designates their own legal medical record as whether electronic or paper-based. Some places have paper-based yet, and usually what happens if they have both, they will scan those papers into the electronic record. So what's an inpatient? These are documents that care and treatment for the patient is admitted to the hospital. Usually it's located in the nursing station, but anymore, keep in mind it's electronic health record. So they have bedside terminals. So if you've been into a hospital seeing a patient, you will see the nurse or physician come in and pull your medical record up right on a computer. They'll take your vitals and they're going to type them in instantly. That's called point of care. Keep in mind, this is why we're getting away from paper records. A 6 to 8 day stay accumulates 60 to 100 pages of paper records. So again, with inpatient data, we have administrative, which is your demographic, socioeconomic, and financial. Clinical is all your patient health information obtained throughout the treatment and the care of the patient. So let's just do some examples of administration or administrative. So this is going to be financial, insurance information, or if it's self-pay. Demographic is going to be, once again, your name, socioeconomic, gender, all of that. Where clinical data is going to be history and physical, progress notes, anything clinical. Then we go into the physician office. Okay, with the physician office, this is when you go to see the doctor. This is the patient health care services that are received in a physician office. They're documented in that record. These again contain both administrative and clinical data. And then we have alternative care settings. With this, it depends on the type of services, accreditation standards, and again, you have state and federal regulations. It once again contains administrative and clinical. With this, remember alternative care settings, we have behavioral, we have home health, hospice, outpatient, and skilled. Depending on the type of services delivered, accreditation standards, and state federal regulations, they all contain administrative and clinical data. Go ahead and refer to page 76. So again, behavioral health, I'm going back one here. This is going to be, again, anything possibly with mental health. Home health is when they come into your home, a nurse, and they do take care of you. Let's say you had a surgery, you have an open wound, they come in and maybe pack it twice a week. Hospice, again, that's going to be towards end-of-life services. Outpatient, that's anything that is, again, that you're not, outpatient services can be ER, observation, and skilled nursing. That is going to be when you don't need acute care. At that point, you go ahead and go to skilled care. This is the ending of PowerPoint 1. And again, reread Chapter 4.